Ladies, have you felt like your body's been betraying you? Well, this is what you need to know if you're over 40. Perhaps you've been feeling more exhausted, not sleeping well, your skin's dry, you've lost a lot of volume, you're exercising and eating clean like you always have, yet you're gaining weight. And now some of that fat has found its way into your midsection. You're anxious, you're depressed, you're happy, you're sad. All of these are the zone of chaos, and it could be your hormones, and maybe it's time to take a look. Hi, I'm Karen Buckalew, board certified nurse practitioner and Menopause Society certified practitioner, and I help women navigate hormonal changes in midlife with evidence-based and personalized care. The basic concept of hormone therapy is to utilize bioidentical hormone therapy, which is molecularly identical to the molecules that your body already produces. So estrogen, progesterone, testosterone, these automatically decline with age. Unlike synthetic hormones, which are different in structure, bioidentical hormones are designed to function just as your natural hormones would. They're able to bind to receptors and be processed in the body in a much more natural, safe, and harmonious way. The most common symptoms for which women pursue hormone treatment are hot flashes, night sweats, mood swings, no sleep, fatigue, anxiety, depression, low libido, bone density changes, vaginal dryness. There's a long list. And as more research has come out, we've also found out that symptoms like dry eye, ringing in the ears, frozen shoulder, all of these symptoms are related to hormone decline. My patients value this treatment because it addresses the root cause of the symptoms. It's not a surface level treatment. It's very personalized to your own symptoms and own lab results. And hormone therapy can offer brain protection, bone protection, and heart protection when offered to the right patient at the right time. An estimated 75% of women experience the hot flashes and night sweats. And new research is showing that the severity of those symptoms can also be tied to cardiac health. Approximately 50 to 60% of perimenopausal and postmenopausal women experience disrupted sleep. This not only affects your daily life, but this also affects your health over time. Then add in mood changes, brain fog and fatigue, unexplained weight gain, low libido, vaginal dryness. This all leads to a very poor quality of life, and hormone therapy may be the answer. Research suggests that starting hormone therapy within 10 years of menopause and often in perimenopause will offer not only symptom relief, but protective benefits. Taking a proactive approach will give you more control over how you feel and how you age. While perimenopause typically happens in your mid-40s, it can happen as early as your 30s. So being mindful of your symptoms and talking to a qualified provider is going to be very important. Don't just accept your symptoms as, oh, I'm aging, I'm getting older. Don't accept a provider telling you that that's just the way it is, because there are medical therapies like hormone therapy that can help you. This is an actual medical condition that deserves treatment. In my practice, I take a very comprehensive approach. We do full blood work and interpret the results with you, because we are also looking to see if there are any underlying conditions. You don't want to just always attribute your symptoms to your hormones are changing. We want to note if there's anything else going on. There could be anemias, nutritional deficiencies. Do you have any risk factors that we need to take into consideration? And perhaps you need further testing. So all of those things are very important in a customized, personalized approach to offer you the right plan and the safest plan for you. Hormone therapy might be the right fit for you if you're perimenopausal or within 10 years of menopause and you're experiencing bothersome symptoms that are truly affecting your quality of life. You aren't performing as well at work, getting through the day at home, with your busy home life and kids, and maintaining in a household. You're a high-powered executive. You aren't able to get through your meetings as well as you could because of hot flashes, not sleeping well, brain fog, memory lapses. The list goes on. So hormone therapy might be the right fit for you to bring you back to your level of function that you're used to. It's important to book a comprehensive consultation, have comprehensive blood work performed, and book your treatment and consultation with a qualified provider. Not all medical providers are going to be menopause certified, so definitely look for one that meets those qualifications. Also be sure to share your personal health history, your family history, all medications and supplements that you're taking, and be prepared to discuss any symptoms that you've been having. The most common and safest way to receive your hormone therapy is going to be transdermal in the form of, let's say, an estrogen patch or estrogen creams, which are considered bioidentical, whether or not they've come from a compounding pharmacy or from your local commercial pharmacy that is bioidentical. Progesterone in the form of micronized progesterone capsules also are bioidentical, coming from your commercial pharmacy or from the compounding pharmacy. You may know other patients that are receiving their therapy in the form of injections, which is also possible. That just allows for more peaks and troughs rather than a steady state. And also pellet therapy. That is not something that I support here at Boutiq Medical Clinic. And you'll also note a lot of the menopause experts are not on board with this as well, because this is not considered a gold standard treatment and also is not an science-backed treatment. A lot issues have come from pellets, many untoward reactions and side effects that I am aware of and many of you may be aware of. But then on the other hand, you'll have other patients say that they absolutely love them. So that's a total personal decision for you, but we follow evidence-based medicine here. When you begin hormone therapy, sometimes you'll notice positive effects in the short term, and sometimes it could be weeks and months. Everyone's completely different. So just monitor your symptoms, follow the plan, and adjustments can be made along the way. If there are any side effects, like sometimes you might feel more emotional, or you might have a little menstrual spotting, you might have breast tenderness. Those types of reactions often resolve as soon as your body makes an adjustment. But this is why it's important to make sure you're with a qualified provider who can guide you along the way. And when started at the right time, research is showing that hormone therapy, which is designed as a long-term treatment, can offer brain protection, bone density protection, and heart protection. One of the top questions is, will hormone therapy help me with my weight gain? So while hormone therapy in and of itself does not promote weight loss, it is going to treat the underlying issue of a form of insulin resistance that takes place when our estrogen declines. So it is going to support the underlying cause, while the hormone therapy is going to help support the root cause of the metabolic slowdown. Oftentimes, we still need to implement our medical weight loss program to help support these weight changes. We also perform an in-depth in-body composition to make sure we're supporting preservation and increase of muscle and decrease of fat and decrease of visceral fat, which is the metabolic fat that becomes dangerous and can cause chronic health conditions. As your specialized midlife and skin NP at Boutiq Medical Clinic, I've ensured to have a suite of options to treat all of the issues that come up in midlife. So Emcella to keep your pelvic floor strong, and then BBL Hero and Moxie for healthy skin, M-Face non-surgical facelift to help with muscle tightening and skin tightening with aging changes. So everything here is to completely support you during midlife and beyond. Just know that I see you, I understand, and I've been through all of this myself. That's why I've ensured to have all of the tools to take care of you in an evidence-based, safe manner. So if you've been feeling fatigued, mood changes, brain fog, or any of the other symptoms that we've discussed today. Be sure to schedule your consultation. I have a special comprehensive method to assist you in feeling better as soon as possible. It's the Radiance Revival Method, which is launching soon. So be sure you visit our website and get on our email list so you'll be the first to know. I look forward to seeing you soon.